Well, today is the first day of August, and that kicks off National Breastfeeding Awareness Month. Dr. Vanessa Walker-Harris is joining me now to talk more about the importance of this month and the things we need to know. Thanks so much for joining us.
Thank you so much for having me.
Well, this campaign was kicked off to show women the importance of breastfeeding. So let's talk a little bit about that. Why is it so important?
Breastfeeding is critically important because it provides a lot of nutrients for the infant, and it's quite helpful for the mom. Virginia rates of breastfeeding are actually quite good, above the national average. We initiate breastfeeding over 80%, but the issue is that the recommendation is that moms breastfeed for over 12 months. That's the recommendation by the American Academy of Pediatrics, but our rates fall off to about 39%. And so grandmothers and fathers and family members can help moms breastfeed for the recommended 12 months.
Wow, now we talk about how it helps baby. How does it help mom?
So breastfeeding is associated with a lot of great improvements and health opportunities for mom. Decreased risk of ovarian cancer, uterine cancer, breast cancer, decreased risk of depression. It helps moms return to their pre-pregnancy rates. And so for infants as well, there's an increased boost to IQ and decreased rates of infection for infants.
Okay. I'm sure you get a lot of questions about breastfeeding, but any misconceptions out there that you hear?
Definitely. There are some misconceptions about comfort levels for breastfeeding, acceptability based on cultural background or family practice, familiarity. And in particular, this is where grandmothers and fathers can come into play. We know that grandmothers who've had a positive experience, positive personal experience with breastfeeding can positively influence their daughters to breastfeed. And fathers who are well educated about breastfeeding can influence moms to start breastfeeding and to continue breastfeeding for the recommended 12 months.
All right, lots of good advice. Where can we find resources for this?
So if you go to the VDH Live Well page, we have an entire page on breastfeeding. The American Academy of Pediatrics has an entire resource page on breastfeeding. So there are a lot of resources out there about breastfeeding, how to get started and how to continue breastfeeding. There are a number of groups out in the community. La Leche League can provide resources for breastfeeding.
All right, lots of good information. Thanks so much for joining us.
Thank you.
And we'll be right back.